It is Indiana in the Morning, always presented by First Commonwealth Bank, and our visit with the graduating residents from IRMC, presented by Marcus and Mack, voted best law firm and best personal injury lawyer 3 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. Can you take that microphone and sort of spin it there? There we go. There we go. As we welcome into the studio three wonderful folks who are completing their residencies. Robin Rodriguez, Mohit Chhatpar, and Nawar Aljanbi joining us here this morning. Aljanbi. And we're grateful that you've all come by to stop and visit with us. And the easy thing to say is, wow, how was that? And how fast was that? Because I bet you it went by really quickly, didn't it?
Very fast.
Yeah, I would think. All right, well, let's talk about it. This ceremony is happening tomorrow, as a matter of fact. And it will be taking place, where at it? At Sutton Hall, in the Blue Room.
Yep.
In the Blue Room at Sutton Hall at IUP. It's at 5 p.m. You'll have a dinner and a big graduation ceremony. Sometimes when you begin a journey that has a timeline with it, you say that, boy, that seems far off. And then all of a sudden that day is here. And Robin, let's start with you here this morning and talk about your time here at IRMC and in Indiana.
Well, thank you for having us back again. I really appreciate it. I've enjoyed my 3 years here, learned a lot through my residency tenure, and I'm going to take what I learned to my new job in New Mexico. Going to be working rural. It would have been wonderful. I was able to stay here. I did buy my first home here, and I have wonderful memories with my patients, my colleagues here, just learning from my program and just learning from the community. But I will be taking the resources that I learned here to my new rural town in New Mexico, and I've just, I've really, really enjoyed my time here, and I'm always going to cherish the memories that I have from being here and having been part of the inaugural program here in IRMC.
When you think about your expectations when you first got here, and then the way that these 3 years have gone by and what has unfolded before you, I don't know if did they meet your expectations will be the thing, but did the experience end up as you expected that it would?
It ended up differently, but in a good way. We were part of the inaugural class, so we're the first. We were the trailblazers of our residency program, and hopefully we set a standard that the other residents that come after us will come and meet and exceed and continue to grow and expand our program, our hospital, and in our community. So being able to be part of that, it was an exciting thought, but you can only kind of just imagine it. So actually living through it, working through being part of the first class, all the barriers that we had to break down in terms of, the hospital learning what residents were, what we are capable of, and just showing them and having that ability to do that. It's been mind-blowing. It's been rough at times, but it's a rewarding journey, and I wouldn't have had it any other way. So.
Mohit, you're shaking your head. Tell me about your experience here.
Yeah, very similar to what Robin was saying. I really enjoyed my time here. I learned a lot from the people here, from my patients, from the attendings, from everyone, the nurses, the therapists. I enjoyed working and interacting with the community here in Indiana. Everyone was very welcoming. I played basketball with some people around the community a couple times a week in the mornings, so pretty integrated, I would say, with everyone here. Really love it here as well.
Think of your background. Where did you come from a background or an area geographically that was sort of like this, or was this a different experience altogether for you?
So I grew up in New York, in Long Island, went to undergrad in New York City.
Same thing then.
Then I went to medical school in Mississippi. So I've seen a wide variety of populations of people, different landscapes, different groups of people. Mississippi was very rural, a lot more than here, I would say. This, I wouldn't call it as rural. I would say more suburban, just from the size and the school being here. But I've seen everything, and everyone here is really great, I would say.
From Long Island to Indiana, PA.
Yeah.
That's quite the cultural leap, isn't it?
Yeah.
Yeah. When you think about your residency here, though, and who you were 3 years ago versus who you are now, and the experiences and the various things that you've done since you've been here, has it changed you at all?
I feel so. I feel more, confident of who I am, competent, built in the medical field, in building relationships with people, just seeing people from all different walks of life while being a resident physician all around the hospital, around town, here, working in Blairsville and in Punxsutawney as well, has been really beneficial, I feel.
When you think about other hospital settings in which you've been in your career, what is IRMC like comparatively?
It's a lot different because it's a more community-focused hospital compared to many academic places which might have like 100 different specialties. You can have every single type of test you want to get done. Here, you might not have all those resources, so you might have to send patients to Pittsburgh, which can be an inconvenience for the patients. But unfortunately, if that's the closest thing that we have, then we have to work with what we have.
Yeah. Well, let's talk to Nawar a little bit this morning, and you can actually pull that microphone up a little bit.
Yeah.
You're a bit taller.
Okay. Is that good?
There you go. That's fine. That's fine. We got you. Let's talk about your 3 years here in the residency program.
Actually, I want to mention something. Like, days were slow, but the years went very fast.
Oh, yeah?
Yep. So I'm very, like, at the end of my residency, I feel very relieved. And I'm also a little bit emotional. You know, I used to work with these lovely people. And also Dr. Barathan, she's doing a night shift, so she was not able to join. She was having a busy night. So, yeah, like, I think all of us are emotional in the last 2 months. You know, we used to work together. We faced all the, like, struggles of residency together. But I'm grateful. I feel like I'm more than prepared for my new role. I will go to join Geisinger Health System at Lewisburg. I'll do primary care over there, and that's what I love. That's what I wanted to do.
When you consider the medical staff with which you've worked here in Indiana, I'm sure that, there within any medical facility, there are tons of different personalities, a lot of different approaches to medicine. Did one or another actually speak to you more than some other style would have? Yeah,
actually, like, and our training, we do different rotations each 4 weeks. So we switch from one department to another. So each department and each attending, they have their own approach to patient care. And it's very interesting. And that's how we get built up. Like, you learn the good stuff from each attending, and by the end, you'll build your own style at the end of the 3 years. Also, I came from, like, I'm originally from Baghdad. I did my medical school over there. And over there, the resources are not very available. So we depend mainly on, like, physical exam and just simple diagnostic testing to reach to the diagnosis. And very interestingly, we're seeing some attendings still practicing this way. Like, we have Dr. Klein, we have Dr. Parks. They really depend on physical exam before ordering any test, which I think the new medicine is like, you order the test, you'll see what will you find out, then you'll talk to the patient. They approach it like the old school way, which is very awesome. Like, you do the exam. Most of the time, you don't need to do an extensive testing before you reach the diagnosis.
Yeah, it's really interesting for us to learn what has been, the journey that all of you have taken. Mohit, we didn't ask you what you're doing next.
So I'll be going for fellowship training in Connecticut for addiction medicine for a year.
Why does that appeal to you?
I feel not many people are getting treated who should be treated. There's a lot of stigma against patients with addiction in general, using different substances. I mean, I'm sure you've probably seen it as well. If someone's using drugs, they might not be as welcomed in society, in their social circles, in their doctor's offices, with their families. So I feel it's a big need, especially here. There's not many people doing it in this whole area, so I really feel it's a big need to learn more about to be able to help these patients.
Yeah. Robin, when you go to New Mexico, what sort of a practice will you be involved in?
I'll be doing mostly outpatient care, but I got hired as an FMOB. I was able to pursue my passion of obstetrics here, and I was able to do a lot of deliveries here in IRMC as well as in Punxsutawney Area Hospital. So I got hired as an FMOB, so I'll be able to deliver my continuity patients down in my small critical care access hospital in New Mexico.
So that's been your passion for a while?
Yes, it has been. So I'm really excited that I get to take that with me and continue to pursue that.
Yeah. And Nawar, what about your expectations with your new position?
You mean like when I started my residency, before I start my residency, or at my new job.
At your new job with Geisinger.
Yeah, we will do primary care. We will take care of people from the birth until so we'll take care of multiple generations,
Mm-hmm.
dad, mom, kids, and grandfather, grandmother.
Yeah. It's real family medicine.
Yep.
When you think about residency at IRMC and what IRMC has been able to provide you with, tell me about that experience. Is it something that you feel was really beneficial to you?
Yes. At our program, they will talk to you from the beginning about your interest, what you want to do. Robin, she wants to do FMOB, so they give her all the opportunities to get deliveries to pursue her certification. Mm-hmm. For me, I wanted to do outpatient, so they gave me a lot of opportunities to be at the clinic or to be at urgent care, so I'll be able to see some cases that require a little bit, rapid care or expedited workup. Also, I want to mention something. The community here they were very supportive, our patients. Okay. I want to give them the credit for making this program successful. They were very patient. At our program, we go see the patient, then we'll go talk to our attending, then we'll go back to talk to them, and this took time. And I never get an angry patient encounter because of the waiting time, because this will take time. And they were we count them as a faculty. Mm-hmm. And that's what makes us love the place. And I always say Indiana's small town with a big heart.
Yep. Nice. Okay. Very nicely put. Mohit, you get the last word today. The residency program with IRMC, you guys are on the ground floor of it. Beneficial?
I think so, just because as the first class, we've endured every type of thing you can imagine, just building the program up, giving feedback, making changes, seeing how those changes work. And then each year we can see, okay, were these changes helpful? If not, then we can reevaluate and change it as we go along. And each year it gets better. Every month it was getting better, actually. But then now we have more establishment going on. So each year, probably less changes are needed just because we helped build it up.
Yeah. Really laid the groundwork, the foundational work. Thank you all for sharing your time and your talents and skills with us here in Indiana for the last 3 years. Wish you the best wherever it is that you go. And of course, tomorrow, the graduation ceremony that will be happening at Sutton Hall. Congratulations to you all.
Thank you so much.
Thank you for having us.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160.